In this lesson, we will make an in-depth analysis about environmental health risks, clean water, sanitation, and air pollution. Environmental health risks, specifically unsafe water, inadequate sanitation, and air pollution, are leading causes of preventable disease and death worldwide. Nurses play a pivotal role in identifying, assessing, and prioritizing these risks to improve community health outcomes. Environmental health risks encompass physical, chemical, and biological factors external to a person that can adversely affect health. In community health assessments, nurses must systematically evaluate environmental exposures, especially those related to water, sanitation, and air quality, as these are foundational determinants of communicable and non-communicable diseases. Understanding and addressing these risks is essential for effective disease prevention, health promotion, and health equity. Now, we will start analyzing the section about clean water access, global burden, disease associations, vulnerable populations, and nursing interventions, 2020-2025. Clean water access remains a critical global health challenge, with over 2.2 billion people lacking safely managed drinking water and millions of preventable deaths each year. Nurses play a pivotal role in assessing risk, conducting surveillance, and implementing evidence-based interventions to reduce the burden of waterborne diseases and promote health equity. Global burden and epidemiology, 2020-2025. Access to clean and safely managed drinking water is a fundamental human right. Yet, as of 2024, approximately 2.2 billion people, 27% of the world's population, still lack this essential service. Among them, 115 million individuals rely directly on untreated surface water sources, such as rivers and lakes, exposing themselves to significant health risks. The consequences of unsafe water, sanitation, and hygiene wash are profound. Each year, an estimated 1.4 million deaths and 74 million disability-adjusted life years DALYs are attributable to inadequate wash, representing a substantial portion of the global disease burden. Children under 5 are particularly vulnerable, with 395 deaths annually linked to wash-related causes, primarily diarrheal diseases. Despite progress in expanding access, rural and low-income populations continue to lag behind, and fragile or conflict-affected settings face persistent challenges in maintaining safe water infrastructure. Disease associations. Unsafe water is a direct vector for a range of waterborne diseases that remain endemic in many parts of the world. Diarrheal diseases, including those caused by pathogens such as rotavirus, Shigella, and E. coli, account for over 1 million deaths annually, with approximately 69% of these deaths attributed to unsafe wash. Other major waterborne diseases include cholera, which causes both endemic and epidemic outbreaks, typhoid fever, often linked to fecal contamination of water supplies, dysentery, including shigellosis and amoebiasis, hepatitis A and E, transmitted via the fecal-oral route, and cryptosporidiosis, a significant cause of diarrheal illness in children and immunocompromised individuals. The burden of these diseases is highest in low and lower middle-income countries, particularly in Sub-Saharan Africa and South Asia. Vulnerable populations. Inadequate access to clean water disproportionately affects certain groups. Children under 5 are at greatest risk due to their developing immune systems, which make them highly susceptible to waterborne infections and the resulting complications such as malnutrition and stunted growth. Rural and low-income communities often lack the infrastructure and financial resources needed for safely managed water, forcing reliance on unimproved or contaminated sources. Women and girls bear the burden of water collection in many societies, spending hours each day fetching water from distant or unsafe sources, which not only exposes them to physical strain and risk of violence, but also limits educational and economic opportunities. Populations in fragile or conflict-affected settings face compounded risks due to the destruction of water infrastructure, displacement, and the breakdown of public health systems, further increasing vulnerability among pregnant women, newborns, and the disabled.